Hello, my name's Maggie and I'm here to talk to you about a problem that you may feel a little bit embarrassed about, and that's vaginal dryness. So why am I here to talk to you about vaginal dryness? Well, I've been a nurse for more years than I care to admit, and I worked in cancer care for over 20 years. But it was after my own experience with breast cancer 8 years ago that I realised that vaginal dryness was a problem that wasn't very well discussed, but it was a problem that many women after breast cancer did experience. So that's why I'm here to talk to you today. I'm here to talk to you today about how vaginal dryness may affect you. It might not be affecting you now, but it's a very strong possibility it's something that you may experience in the future. And I want you to know about the solutions that are available to you after your breast cancer treatment. So vaginal dryness is something that actually many women may suffer with throughout their lifetime, but mostly it's something that women experience around the age of the menopause, about the age of 51. The menopause is when your natural estrogen levels are in decline, and this can lead to all sorts of menopausal problems, and some of them you may have discussed already. So hot flushes is an example of one that's talked about a lot, but vaginal dryness is one of the ones that's not very often discussed, but it is a symptom of the menopause, and as I say, it's most often occurs around the natural age of the menopause. But as a breast cancer patient or someone who's experienced breast cancer and had breast cancer treatment, it may be that you're being affected earlier than this. It could be because you've been through chemotherapy, it could be because you've had to have your ovaries removed, or it could be because you're on anti-estrogen therapies. All these things may lead you to be experiencing vaginal dryness. It could be that you've been through the menopause already, but because you're on some of these drugs now, you're experiencing these menopausal symptoms again. So what happens to the vagina when you've got a decline in estrogen? Well, when we have estrogen naturally throughout our lifetime, this keeps the vagina moist, and you have a thin layer of clear fluid that keeps our vaginas lubricated. When estrogen is in decline, this lubrication naturally diminishes. The walls of the vagina become thinner and drier and less elastic. The area around the vagina and the genital area is thinner and less well supported. This can lead to everyday discomfort. It can lead to women experiencing problems with friction when they're walking, when they're playing sports. And of course, it can lead to painful sexual intercourse. Now, painful sexual intercourse may mean that you start avoiding sex. It may mean that you don't discuss it with your partner. This can lead to all sorts of relationship issues. So it's really important that you know what you can do about it, and how you can increase your vaginal lubrication.